So if I could hand over for the closing words to Professor Neil Douglas and thank him for all the work he's done as leader and counsel and setting up the faculty.
Thanks, Jill. There'll be very brief closing words. Peter and I agreed to bring this conference to Edinburgh for 4 reasons. One, of course, is Edinburgh is a great place, particularly when it doesn't rain. 2 is that we were offered a very cheap rate on this venue, which appealed to the Scot in me and probably to Peter. 3, that it allowed us to convince, we hope, the English that there are other healthcare systems in Scotland and Wales and Northern Ireland that do work in some regards. But 4 was because there was a myth in Scotland that the faculty was an English organization, and I really wanted to dispel that. So I hope you've enjoyed the consequence of all of that by coming to Edinburgh. As far as I can see, the buzz around the meeting has been great, and we've certainly enjoyed the huge input from the juniors and the medical students. I do need to say 1 or 2 thanks for the people who've helped make this a successful event, and also to say thanks to people who've helped the organization generally. The first thanks is to Jill, who for the 2nd year in a row, I will disappear back to my microphone, has done a sterling job in chairing the sessions, the panel sessions, in a gently provocative fashion to gently annoy 1 or 2 of the people and get them to be spirited in their defenses of their positions. And she is a past master at this. The second is to Bruce, because without Bruce's input, this organization would never have existed in the first place, and his continued support has been absolutely invaluable. Thank you, Bruce. Third is to Peter. I thanked Peter before, but I will continue to thank Peter, I hope, for several more years yet, if he allows me to do so. He has been the person, as you all know, who has led this organization and has the vision to take it forward. And the 4th thank you is to Carla and the team for a vast amount of work that they have put in to organizing this. She's over there, quietly in the background as per usual. So I hope you have enjoyed it. We are delighted to have had more people here than our very successful initial meeting last year in Manchester. And the buzz certainly seems to have been as good. Do go back home and make use of everything that you have heard. And I would ask you each evening, or at least once a week, to ask yourself, what have you done today or this week to help patient care and improve care for your patients? If you can answer yes to that, then you may feel slightly better about the miserable week you have otherwise had. And we're very bad at giving ourselves strokes. If you don't answer yes to that, well, you should answer yes, and you should feel miserable. Goodbye, enjoy yourselves, and I hope to see you again next year.